Hi everyone, my name's Becky Ketron. I'm a Senior Program Coordinator at Montgomery County ADAMHS. ADAMHS is an acronym that stands for Alcohol, Drug Addiction, and Mental Health Services. So you can see why we shortened that. It's a lot to say. This is just our overview of who ADAMHS is, what we do, but I was also asked to talk specifically about one of our training programs, and I work in the Community Training and Staff Development Department, so I am going to talk specifically about mental health first aid towards the end. To start, this is ADAMHS. Feel free to try to pick me out of the picture. I am up there. These are our staff. Well, there's about 32, I think, of us in three kind of main departments. Our main objective is to promote behavioral health in Montgomery County. That's a simplified version of our mission and vision. Has anybody here ever donated to the United Way? Anybody done that through a campaign or just on your own? ADAMHS kind of acts the same way that United Way does. When you donate money to the United Way, they collect all those donations and then they grant them to different nonprofits in the community who are providing direct services to the residents. ADAMHS does the same thing through the Human Services Levy. So we are one of several organizations that's funded by the levy. So it includes us, Public Health, Children's Services, Developmental Disabilities, Area Agency on Aging. All of us get Human Service Levy dollars. And then what ADAMHS does with that is we then, the different providers in the community who are offering behavioral health services, either mental health treatment or addiction services, they apply to us for that funding. And we grant that funding, but that's not all we do. Since that is taxpayer money, a big part of what we do is also monitoring those services, making sure that they're doing what they said they were going to do with those funds. We also try to look for gaps in services. So is there a service that our community needs but nobody is doing? And can we work with a provider like Educational Service Center or South Community or Samaritan Behavioral Health or any of those others to try to start that service or start that program? The other thing we do with the looking for gaps is, are there areas, geographic areas in our community that are underserved, that don't have the resources in their area, and try to see if providers would be willing to go into those areas and offer the services. Our funding primarily comes from the Human Services Levy, as I said, but we also get money from the state of Ohio, the Department of Behavioral Health. Their funding helps support what the levy doesn't cover or can't cover. We also get some federal funding through SAMHSA, which is the behavioral health department at the federal level. We also apply for grants, tons of grants, lots of grants, again, to try to supplement what the levy and the state and federal funding can't cover, or to do special projects. Over the last few years, we've had grants to help us do more training. We've had grants to help try to build the workforce in behavioral health. We need more counselors and therapists, and to try to help promote that, try to help people get those degrees or expand the workforce of our behavioral health providers. I think these numbers, I think this budget, the $44.7 million, I want to say that was 2024. We haven't done our 2025 impact report yet, so I don't have last year's numbers. There's some information here about our demographics, who we serve. Again, I think this was from 2024. So you can see by race, by age, and by gender, who are the people who are benefiting from the services that ADAMHS is funding. Our providers have to report to us their outcomes, because they've obviously applied for the money and they've said they're going to meet certain benchmarks. They have to report to us how they're doing on those services. So that's where a lot of these numbers come from. We have several divisions and departments. For a small organization, we have a lot of different departments. We have treatment and supportive services. They are obviously focused on the behavioral health treatment side of things, the providers who are doing those direct therapy and treatment services, or supportive housing, things like that. Then our prevention and early intervention department which is where we partner with the ESC, really focused on how can we prevent mental health issues, how can we prevent addiction and substance use disorders. A lot of the work that they do is in schools, trying to educate young people and teachers so that we can prevent that age of first use, or at least delay that first use. That is a huge risk factor for people to develop a substance use disorder. Is the younger they are, the higher their risk of developing a disorder. So trying to prevent that and intervene early, get people to supports, teach them coping mechanisms and coping skills so that they don't need those services later on in life. Then of course, my department, the community training and staff development, where our purpose is primarily to do trainings for behavioral health providers, but we do training for anyone in Montgomery County who wants it. We have a very large community training calendar that goes out. We do about 300 trainings a year, and we will come to you and do them for your employees. We will go to schools on their PD days and do training for them. So it's not just behavioral health, although that is our primary audience. We also have strategic initiatives and communication. That's our PR department. You all probably have something similar, somebody who runs your social media and makes all of your handouts and the things that I brought. We also have our finance department, which takes care of paying the bills, but they are also really key in helping our providers pull down funds from what we've allocated for them from the levy, but also trying to help them be more sustainable by looking at other grant opportunities. We have a grant writer on staff who does some training and technical assistance with our providers to try to help them diversify their funding so that they're not as reliant on the levy. We can't always guarantee that the levy is going to pass. We can't always guarantee the amount we're going to get. So trying to help them diversify and become more sustainable. And then we have our administrative department, which is human resources, contracts, IT, all those sort of supportive pieces that the rest of us need to be able to do our jobs. So in the treatment services, these are some of the services that they've provided and funded over the last years. There's a lot on here. Some of the big things that we do are working with the judicial system for people maybe who have involvement with law enforcement and need to have someone to speak about their capacity, right? So you have people who have mental illness who maybe get in trouble and need that subject matter expertise to help work them through the law enforcement and judicial system. We also have a big program and supports around housing, because a lot of times people who have a mental illness or who have a substance use disorder might lose their home, might lose their housing, and how can we help support the providers who are offering those services so that somebody has a safe, healthy place to live while they recover and work on getting better. We do have a training on crisis management and de-escalation, but most school systems use a curriculum called CPI. Most schools use, it's Crisis Prevention Institute is the name of the company that does that training, and school systems are pretty heavily invested in that, and it does teach de-escalation to teachers, as well as like self-defensive things if a student is getting physical. So we don't go to that level where it's the physical intervention. Now we don't go to Cincinnati. Cincinnati is in Hamilton County, and they have their own. Yeah, they have their own ADAMHS board. Every county in Ohio is covered or has an ADAMHS board. Sometimes it's called a mental health and recovery board, or it's called an ADAMHS board, but every county in Ohio is covered by one. Some counties have sort of banded together and they cover multiple counties. So for example, the Tri-County Board of Mental Health and Recovery is Miami, Dark, and Shelby counties. So those three counties have one board. Clark, Madison, Greene have one board. Some of the bigger metro areas like Montgomery, Hamilton we just have the one county. We are mandated by law, ADAMHS boards are mandated by law to support the the mental health and addiction behavioral health providers. So that is what we are supposed to do, no matter what county you're in. They are the ones funding and supporting those behavioral health providers. Whereas a little different is the training side. So training is not a mandated service. ADAMHS boards don't have to do training. We're very lucky in Montgomery County that our board and our executive director are very supportive of training. They see the value in that staff development for people. And we're one of only, I think, 3 or 4 ADAMHS boards in the state that have dedicated training staff. So it's us, Stark, Cuyahoga, and I think either Hamilton and Franklin may have like 1 person that they do training or they coordinate training. I'm not sure if that's their sole job, but for us, our training team has 3 people, and that is all we do is training. I want to say 24/7, but that's not true. We don't really do it 24/7, but Monday through Friday during work hours. So we do training. That is our sole job. Treatment services is one of our departments. The other one is the prevention department, which I mentioned earlier, doing a lot of work in schools with young people, trying to provide education about substances and mental health and coping skills to try to prevent issues from happening later on in life. There's been a lot of research done for young people in particular about the things that help prevent mental health issues, suicidal thoughts, substance use issues, and that there are protective factors that we have in place for young people. And the number 1 protective factor for young people to help prevent those negative things later on in life is having one caring adult in their life. So we are very much dedicated to trying to put those protective factors in place, including those people who can support them and teach them. The Montgomery County Prevention Coalition is a volunteer organization that, again, focuses all on prevention, but they're focused on a lot of different types of prevention, and they've really expanded this. So it's not just about mental health and addiction. They have a suicide prevention committee, a self-care promotion committee, trying to help teach people how to cope and deal with difficult circumstances, to have some distress tolerance skills. We have the Retailer's Care, which is all about trying to work with those places like gas stations, drive-thrus, the UDF type corner store. If you ever look at those when you pull up, if you're going up, you're going in there to grab a snack or grab a thing of pop, look at their advertising. Look at the things that they have in the window. A lot of them are promoting substances, promoting alcohol. And so the Retailer's Care program is trying to work with those retailers to shift where they put those things so that they're not at kids' eye level, right? And trying to help young people understand that they are being targeted with those things, with the different flavors and the colorful packaging. There's also a problem gambling and gambling prevention committee, power-based violence, policy and advocacy, opioid-specific prevention, marijuana-specific, alcohol-specific prevention. So 20 local providers that got funding in 2024, but there are about 300 people who are volunteers as part of the coalition, which is sort of outside. There's no funding. They don't get funded if they're on the coalition. But people can join a particular committee and work on projects to try to help prevent those particular issues. Now we can talk about training. My favorite thing to talk about. Our Community Training and Staff Development Department, I do have 2025 numbers because I'm the one that tracks those numbers for that department. So last year we had 290 sessions like this. This is considered a session, and there were a little over 6,000 people that attended. At least half of those are behavioral health providers, but we do training for companies, organizations, schools, anybody who asks, really. And if you're in Montgomery County, we offer those trainings for free. There is a place on our website where you can subscribe to get the training calendar delivered to your inbox. We send that out quarterly. The next one will come out March 1st. They are all open to anybody to attend. Anything in that calendar, anybody can come to. There is, for example, with mental health first aid, when people go through through the community calendar, there's a charge, but when people attend the class, they get that refunded back to them. So it is essentially free. But it's a full day class and it's a certification course, and so we want people to have some investment in it to actually show up and follow through with the class, which is why we charge. But we have other categories of training, so we do some things around addiction and substance use disorder, other kind of clinical topics, things like diagnosing and treating particular conditions. I think we have one coming up on personality disorders. So offering some more specific clinical topics to our providers. We also have a prevention category, so any kind of prevention-related topic. We also focus on resilience. How do we help people develop those distress tolerance skills and new coping skills? Whether it's because they have a stressful job or because of things in their family or the state of the world. This really blew up during COVID, and we had a big demand for people to they wanted to learn for themselves, how can I handle and manage what I'm feeling right now? So that has really expanded. We also have a category specific around suicide prevention and helping people understand what are the signs to look out for, but also how to talk to somebody who might be having suicidal thoughts, how to ask the question, how to refer them to help. We also have a category for social equity and trauma-informed. Those are sort of our broad categories, and then we have specific topics under each of those. Here are some of the trainings that we do, some of the topics, the actual topic names, highlights from 2025. So you see mental health first aid on there, which I'm going to dive a little bit deeper into. Some of these trainings we contract with subject matter experts and bring them in to present these things. Some of these are trainings that our providers have developed and they have a subject matter expertise in. So we have them come and present for us. We've had people from the Educational Service Center come and present. One of the ones on here, Generation RX, is presented by Goodwill Easter Seals. They're another one of our providers. That is a training about how to safely store and destroy old medications, because there's a risk there, depending on the medication, that somebody might get into that medication who it's not prescribed to them. So how do you safely store that medication, and when you're done with it and you don't need it anymore, how do you destroy it safely? Our crisis intervention training for law enforcement, dispatchers, and behavioral health providers. So we do a full week of training for law enforcement about mental health conditions and addiction so that they can understand sort of the science of why somebody might be experiencing those things, what are signs and symptoms, but then also how to interact with somebody who might be having a mental health crisis. This is where I think your question can be answered about curriculums, right? So some of these, some of the classes that we do are standardized curriculums that we are trained in and authorized to be able to present, and other people can go through and get trained by it. So for example, mental health first aid is owned by the National Council for Mental Wellbeing. Anybody can go through their Train the Trainer, their instructor course, and become a certified trainer to be able to present that course. Some of these others were developed and presented by those subject matter experts. We can't share, obviously, their stuff because that belongs to them. And some things we've designed in-house, and those could certainly be shared with people. A lot of places have started implementing this as part of their wellness program, right? So they take this focus on, this is about our employees' wellness. And so they will bring in us or other speakers to talk about mental health, to talk about stress management. I think, and I'll ask all of you, would you say that in your company or in your agency that there are people who have mental health challenges? That probably, right? Most likely. 1 in 5 Americans is gonna have a diagnosable mental health condition at some point in their life. So when you extrapolate that for an agency, there are people who have mental health conditions. That's why we promote mental health first aid so hard, because it teaches you skills to interact with somebody and to help them when we see the early signs, rather than waiting for a crisis, right? A lot of times we don't want to talk about it, but that just makes things worse, right? We really try to combat the stigma around addiction and mental health, because that's what prevents people from going and getting help. NAMI did a study. NAMI is the National Alliance on Mental Illness, and they did a study several years ago. They were looking at, how long do people wait from the time they start experiencing symptoms before they actually go and get help. Does anyone want to guess what time frame that is? From experiencing the first symptoms until you make a call and say, I need help. Anyone want to guess how long that is? 6 months?
2 years.
2 years? Anybody else? Did you say 1 year? 7 to 10 years. Because of the stigma, right? It is a very difficult conversation to have with someone, let alone my employer, right? To say, hey, I've been having suicidal thoughts. That is not, some people don't just blurt that out, right? Some people may, but most people do not. When people say, hey, I'm really struggling with anxiety, there are a lot of times people are struggling with something, but they don't know it's anxiety, right? They're like, well, something's not quite right, but I don't know what it is and I can't articulate it, and so this just must be normal. This just must be what everybody feels, and so they don't talk about it and it gets worse. Or they're afraid of the stigma and the judgment that they think they're gonna see on the other person's face, right? Or especially in an employment situation, I don't wanna lose my job, I don't wanna not get considered for a promotion, I don't wanna get demoted, I don't want my projects taken away from me, I don't want my coworkers to look at me differently or treat me differently because I have a mental health issue, right? So that stigma is what is contributing to that 7 to 10 years. And we would never do that for a physical illness, right? I mean, if you broke your arm or your leg, you would never wait 7 years before you got it treated. What happens if you wait that long to get something like a broken leg treated? What would happen if you waited 7 years?
Be a lot harder to heal.
Yeah, it's gonna be a lot harder to fix or heal, right? It's probably gonna heal incorrectly. Are you gonna be able to work? Are you gonna be able to take care of your family or yourself? Probably not, right? So, but we do that with mental health and addiction because there is that judgment. We would never judge someone for having a broken leg or for having asthma or diabetes, but mental health and addiction, people face a lot of judgment around. We do not provide direct services. We are the funder of the services. So what we would end up doing is referring people to the Local Help Now website, which is another card that I set out here for you all to pick up. And I've got a whole box of these things. So please feel free. If you want a big handful to pass out to everybody, I've got more. Because this is where we send people to go and find a provider. So if they wanted to help an employee find a therapist or a counselor or an addiction treatment center or whatever the situation might be for that employee, this is where we would send them. This is like the yellow pages of behavioral health. Does anybody remember the yellow pages?
Would you send them a list of people, or would?
It's on this website.
Oh, okay.
Mm-hmm.
So you're
But
not
it's
promoting one particular.
correct. Yeah, we
therapist or
can't do recommendations. We can do referrals. So we can't like recommend this provider over that provider. We're not allowed to do that. We have to be, we have to be neutral. But that's also what this is. This is just the analog version of that website. So if anybody wants, again, I've got tons of these. You take the whole packet. They're just tear-off sheets that have our funded providers on them. There are more providers listed on the website. These are the funded, the ones that we fund. And sometimes people like to have a piece of paper, right? The thing that's nice on the website is that you can filter it. So you could filter it by zip code, for example. Some people, maybe they work in one zip code, but they live in another one, and they would prefer to go for services closer to where they live. So you can filter it by zip code. You can filter it by payee. So will they take Medicaid or Medicare? Do they do a sliding scale? Do they take insurance? And that can help narrow down that list of providers that they can then call and say, hey, this is the issue. Do you have openings? Can I get in? The other thing that we often encourage employers to do is if they have an EAP, How many of you have an EAP through your benefits, an employee assistance program? A very underutilized resource in the benefits and HR space. Y'all may feel that, like people, your employees know, you tell them when you onboard them, we have this EAP, here are your other benefits, here's the services you can get, but people forget, right? They're overwhelmed during onboarding. And so they forget those little things. And then as things happen in their life, that's kind of gone to the back of their mind. And EAP is a really underutilized resource. It depends on your benefits plan, but usually you get several free counseling sessions. It can vary. At Montgomery County, ours we get 6, but I used to work for Clark County and we got 10 free sessions per year per person in the household. So it wasn't just for the employee, it could be for their spouse, it could be for a child. And the thing that I think also prevents a lot of employees from using that is that they think that their employer is going to know, right? If I call up EAP and say I need to get a counseling session in, they think that EAP is going to call their boss and say, did you know that Becky has called and she's asked for a counseling session because of XYZ issue? But they can't do that. HIPAA, they can't provide any of that health information, personally identifiable health information. Some employees do use EAP when there's like a interpersonal conflict. Maybe you all have had that experience where you've had employees who need counseling to continue working there, right? To work through an issue, but it's specific to the employee, their job, their interactions with other employees. And it might be mandated that somebody go to EAP as part of that PIP or that performance improvement plan. EAP can only verify that the person showed up for their appointment. That's all they can do. They can't say anything that the therapist or counselor talked about, what the employee said. All they can do is verify the person showed up to the appointment. But I think a lot of times employees think, oh, well, my employer's gonna know. They can't tell. So it's a really underutilized resource, and that would be what we would also recommend, is that if that agency or that company has an EAP program, to pull in those folks as well. It's part of their benefits. They're paying for it, so might as well access it. We, of course, would come in and do training if they feel like they wanted to have all of their staff trained in mental health first aid or in suicide prevention. There are occasions where someone dies by suicide at a company or an organization, and we don't do the training immediately after that. That's not the time to train everyone on the signs and what they should have done, right? Because we don't want anybody to feel bad that they missed a sign and they didn't do anything. But there are some what's called postvention, or instead of intervention or early intervention, it's postvention. There are some resources there that we can connect agencies to, again, to help their employees manage how they're feeling about that event. We also, just this last year, this isn't in training so much, although there are training components to it. We have something called the Loss Team, and it's local outreach to suicide survivors. And what we do is, if there is a death by suicide in Montgomery County, law enforcement has the contact information, the coroner's office has it, dispatch has it. They call us, and we have volunteers who are survivors of suicide. They've had maybe a family member who's died or a friend. They've gone through some specialized training, and they come to the scene to offer supports to the survivor in that case. And they also do follow-ups. They try to support that person ongoing, not just in the moment, but the next day, the next week, the next months. Anniversaries can be really hard for people. And so that volunteer organization will reach out around that anniversary, again, to offer support and help. Okay, so mental health first aid, I've already kind of mentioned it. It is through the National Council for Mental Wellbeing. They own that curriculum. It's actually an international program. It actually started in Australia, and then came to the US and has gone all over the world. And basically helps people identify and understand how to respond if you see signs of someone who might be struggling with their mental health or struggling with substance use. And some of the stats, this is sort of the why. On average, 130 people die by suicide every day. To put that in context, that's like one commercial jet every other day. That's a lot of people, right? And it is preventable. Between 1999 and 2019, 841,000 people died from drug overdoses, and nearly 1 in 5 Americans will have a mental health issue or be diagnosed with a mental health issue in their lifetime, which I mentioned that stat earlier. That's a lot of people, right? I mean, if you can think of 5 people in your life, one of them likely has or will have a mental health condition. The great thing that mental health first aid really focused on is similar to first aid and CPR. You don't have to have a medical degree to go through a CPR first aid class, right? How many of you have first aid and CPR as an offering like that you do for your staff, right? Or it's a requirement. This is that same kind of idea, but for mental health and addiction. So it's not meant for mental health professionals, it's meant for all of us. It's meant for the regular, everyday person who doesn't have a background or education in mental health or addiction to be able to help someone who might be struggling. So and same with first aid CPR, right? It's that immediate help that we offer someone before professional help arrives. That's the same idea with mental health first aid. It's just focused on people's mental health. So teaches a 5-step action plan that has an acronym, of course, because always have to have acronyms. The acronym is ALGE, and it walks people through that action plan. They get a chance to practice it in a safe environment. We don't do role plays. If anybody's like, I hate role plays, that's me, I hate role plays. But we do it in a safer environment where we sit and we have a scenario and we talk through it and we apply this action plan. So we assess, we approach and talk about what's a helpful approach, what's a not helpful approach to get someone to interact with us. We talk about listening, but very specifically, listening non-judgmentally. And we talk a lot about the stigma that is associated a lot of times with mental health and addiction and how to overcome that. We talk about giving reassurance and information, which we also phrase as hope with facts, because there are a lot of people who have misinformation, right? Even though they're applying that misinformation and that stigma to themselves. So we try to talk through what does that sound like? How do we give someone reassurance? And then we encourage either professional help or self-help and other support strategies. And we talk through who are those professionals that we can refer someone to? Where are the resources that we can connect them with? And in the meantime, how can we encourage them to take care of themselves? And what are some healthy coping mechanisms that they can access? So the topics covered are those approaches, how to recognize early warning signs, worsening signs, and then also what do we do when it's a crisis? Ideally, we want to look at early warning signs, right? And we want to intervene then. If we can do early intervention, we can see better outcomes later. So we would really spend some time there. And some of the crisis signs and symptoms that we talk about, specific conditions or issues, things like panic attacks, aggressive behaviors, trauma, non-suicidal self-injury, suicide, overdose, and severe psychotic states. So we kind of dive a little deeper into each of those in their crisis state and talk about how would we use this action plan to help de-escalate, help try to manage what's going on and get that person to help. National Council for Mental Wellbeing has mental health first aid valued at $170 per person. But as I said, we do it for free to those in Montgomery County. We can take up to 30 people in a class. If you have more than that, we would just split them into 2 or more classes. We can do those concurrently. Usually, it's for an employer, it's going to depend on your operational needs, right? If you can't have 30 people in a class all at one time because you've got to get work done, we work with you to try to figure out what makes sense. You know, maybe that's sending people through one of our community classes and we would put a hold on some seats for you, or we spread out the offerings over the course of a year so that you can kind of cycle people through, whatever makes sense for you. It is a 3-year certification, just like first aid CPR. It consists of 2 hours of pre-work that's done online ahead of the class. So that's sort of the foundational knowledge. It kind of is talking about some of the statistics and what's the difference between a sign versus a symptom, and what are the different types of disorders that somebody might be diagnosed with, and what are some of the signs and symptoms for those different diagnoses. So it kind of gives us a foundational knowledge that then when we come together for an in-person or an instructor-led class, we don't have to cover that background, right? Everybody kind of comes in with a base knowledge and we jump right into the action plan and how are we going to use that when we're concerned about somebody. So they do that before the instructor-led class. The instructor-led portion can be done either virtually or in person, whichever is preferable. Some people like the virtual. Some people like in person, so we can do that either way. It is a full day. It's normally scheduled from 9 to 4 with breaks and a lunch, of course, but it is a full day class. We can split it into 2 half days, but those 2 half days can't be more than a week apart. So again, depending on your operational needs, we can adjust that a little bit. So anybody who works with other people or interacts with other human beings, I mean, I am biased, but I think everybody should have mental health first aid training. The great thing about that, the training, is that you might be taking it from the perspective of how am I going to use this with my employees? Maybe I'm in HR and I'm having to deal with people who get in trouble or are struggling with their performance and I'm having to coach them or I'm having to meet with them. That it's very valuable then to have mental health first aid, right? But it's also helpful for the person working next to me, for them to also have mental health first aid training, to be a support to me as well, right? So it's something that can be applied in the workplace, but you also will find that you use it with your friends, your family, other people that you interact with outside of your employment. Can be used with anybody. These are some of the resources. We have the local help now on there, of course, 988. So it used to be the suicide lifeline, and it was an 800 number. They turned it into 988 so that make it easier for people. You don't have to remember 10 digits. You only have to remember 3, just like 911, right? And it is nationwide. So when you call 988, just like if you call 911, you're going to get connected to your local supports and help. So the other cool thing with 988 now is that you can text that number. There's also a chat function, so you can chat. People who are younger, adolescents, sometimes don't want to make a phone call. That feels intimidating to them. They're not exactly sure, what do I say when somebody answers the phone? It's easier for them to text or chat. So it's really cool that they have that as an option for people now. Sometimes that's more comfortable. Again, remember, there's a lot of stigma around this. So having to be vulnerable and say, hey, I'm really struggling. I'm having a hard time with this situation and I don't know what to do. That is opening them up to some judgment, right? That's the concern that they have. 988 is, and being able to text that or chat with somebody feels a little bit less intimidating than having a person on the other end where you're having to hear their voice. We also have the Miami Valley Warm Line. I have that up there. That's for situations that aren't a crisis, right? If it's a crisis, we need to call 988. But the Warm Line is available for people who just need someone to talk to, right? Maybe they're struggling, but it's not a crisis. They just need an impartial person to talk through something with them. That is available in more limited hours. It's like Monday through Friday from, I think it's 11 a.m. to 7 p.m. So it's a more limited amount of time. It's not a 24/7, 365 like 988 is, but it is available if somebody's just struggling, they just need to talk to somebody.